Hi guys, this is Dr. James from Finding Detox Secrets. Today I'd like to talk about how you can improve rheumatic arthritis with supplements. So I'd like to introduce a case in which I consulted a person who had rheumatoid arthritis for 6 years and helped him drastically with his symptoms. Rheumatoid arthritis, also known as RA, is a chronic inflammatory disease that affects the body. It particularly affects the joints, which includes hands, feet, wrists, ankles, and knees. It occurs in 1 to 3% of the US population. The incidence in women is 3 times higher than in men. Rheumatoid arthritis usually develops gradually. In some cases, it happens suddenly. Symptoms of rheumatoid arthritis include fatigue, low fever, weakness, stiffness of joints, and vague joint pain several weeks before the joints swell. The early symptoms of rheumatoid arthritis are stiff joints. These symptoms are most severe right after waking up in the morning. This stiffness is relieved by moving the joint for 1 hour. In addition to joint-related symptoms, symptoms such as weight loss, fatigue, and mild fever may appear. About 1/3 of rheumatoid arthritis patients have severe systematic transpiration. Multiple joints are usually involved when the onset of the disease begins. It appears on both hands, wrists, and ankles. The skin of the joints has a reddish-purple tint. As the disease progresses, deformities occur in the joints of the hands and feet. Rheumatoid arthritis is an autoimmune disease. In other words, it is a disease in which our own immune system attacks our body. Let's talk about the causes of rheumatoid arthritis. First, genetic factors. Genetic factors can be one of the factors causing rheumatoid arthritis. About 70% of rheumatoid arthritis patients have a specific gene. This gene is called HLA-DRW4, but people without rheumatoid arthritis have 28%. If a patient has rheumatoid arthritis, their children are 4 times more likely to develop severe rheumatoid arthritis than if they did not. However, the presence of genetic factors does not necessarily mean that rheumatoid arthritis develops. However, environmental factors are just as important as genetic factors. Second, intestinal dysfunction. Abnormalities in intestinal permeability due to intestinal dysfunction are associated with the rheumatoid arthritis. Patients with rheumatoid arthritis show high intestinal permeability of dietary components and bacterial components, which is antigens, from which the human body forms antibodies. High intestinal permeability indicates that high possibility of leaky gut. Westernized eating habits, obesity, drinking, smoking, and excessive stress all cause leaky gut. In addition, non-steroidal anti-inflammatory drugs, also known as NSAIDs, easily found in local pharmacies, also contribute to increasing intestinal permeability. Long-term use of the above NSAIDs can easily cause bleeding and perforations in the gastrointestinal wall and can lead to leaky gut syndrome. Third, abnormalities of antibody and immune complexes. The serum and joint fluid of almost all rheumatoid arthritis patients contain antibodies that attack IgG antibodies. In simple terms, IgG antibody is a substance made to protect our body from external enemies. However, in rheumatoid arthritis patients, the immune system is compromised. Fourth, low DHEA levels. A defect in androgen production has been suggested as the cause of rheumatoid arthritis. Androgens are main hormones such as testosterone and dihydroepiandrosterone. The finding of the research team at Stockholm University Hospital in Sweden published their finding in the Journal of Rheumatology. These results were studied in 101 men with rheumatoid arthritis. These patients found that DHEA and estrogen levels were significantly lower compared to healthy people. So let's talk about rheumatoid arthritis treatment. First, drug treatment. Common drug treatments include ibuprofen, paroxetine, diclofenac, phenprofen, indomethacin, naproxen, Tormentin, and Sulindac. These drugs are non-steroidal anti-inflammatory drugs, also known as NSAIDs. The advantage of this drug is that it can relieve inflammation and pain quickly. However, it does not prevent joint damage. As mentioned above, NSAIDs can cause leaky gut syndrome because they increase the permeability of the gastrointestinal tract, but they are used for standard treatment of rheumatoid arthritis. Additionally, It can cause various gastrointestinal disorders such as gastric ulcers, gastric bleeding, and perforation. It's really surprising that I did not learn of any of these things in graduate school. Therefore, if you are currently suffering from rheumatoid arthritis, ask yourself whether it is right to continue taking NSAID medications. Second, steroid therapy. When non-steroidal anti-inflammatory drugs are ineffective, steroid therapy is used. Steroids are drugs that are originally intended for short-term use. However, when long-term treatment is required, such as rheumatoid arthritis, long-term use of steroids is inevitable. Steroids usually have an anti-inflammatory effect within 24 hours of taking them. As many know, steroids should start at low doses. In general, low doses prednisone should be started at 7.5 milligrams or less per day. When used in high doses, it is necessary to check in advance whether vasculitis has systemic disease such as epilepsy. Patients receiving intra-articular injections should receive injections at least 3 to 4 months apart. Third, anti-rheumatic drugs, commonly referred to as DMARDs, or disease-modifying anti-rheumatic drugs. They slow down the progression of rheumatoid arthritis. As rheumatoid arthritis causes permanent damages as it progresses, anti-rheumatic drugs are used to protect the joints. The effect does not appear immediately after taking the medicine, and it usually takes 1 to 6 months for the effect to appear. The MARDs include methotrexate, sulfasalazine, leflunomide, and anti-malaria drugs. TNF blockers. This drug blocks TNF, a representative mediator that causes rheumatoid arthritis. The effect of the drugs is rapid because it improves symptoms by more than 70% in rheumatoid arthritis that does not respond to anti-rheumatic drugs. Now let's talk about the rheumatoid arthritis supplements. The following are nutritional supplements that I have recommended to a person who has suffered from rheumatoid arthritis for 6 years. After taking the recommended nutritional supplements for 2 weeks, I heard that he was able to stop all the correct medications. However, since the amount of absorption and metabolism varies from person to person, the nutrients that I have suggested may not be suitable for you. So it is recommended that you consult with a specialist for treatment. First, a multivitamin supplement rich in phytonutrients. Patients suffering from various diseases, including rheumatoid arthritis, often lack various vitamins and minerals in their bodies. For this, it is strongly recommended that you find a nutrition supplement that suits your body and take it as soon as possible. Second, omega-3. In a double-blind control study of arthritis, patients using 1.8 grams of EPA per day. The EPA-consuming group had fewer morning stiffness and tender joints. Omega-3 supplements suppress the production of inflammatory components secreted by white blood cells, as well as morning stiffness and joint tenderness. If you're considering buying omega-3, please stay away from buying the cheapest omega-3 on the market. These cheap products on the market usually use low-quality oil, and in many cases, the oil is oxidized and degenerated into lipid peroxide, which can actually harm your health. Vitamin C. Serum tests from the rheumatoid arthritis patients often showed low levels of vitamin B6, vitamin C, and zinc. Vitamin C helps blood vessel health and helps prevent anti-inflammation and cancer. Studies have shown that people who eat less fruit and vegetables, which contain high in vitamin C, are twice as likely to develop arthritis. Dietary fiber. Seaweeds and fruits and vegetables are rich in dietary fiber and are good nutrients for the synovial fluid surrounding cartilage. According to the study, people who ate food rich in dietary fiber had lower levels of C-reactive protein, also known as CRP, in the blood. The CRP indicates the level of inflammation in the blood, and it has a deep relationship with rheumatoid arthritis, as well as cardiovascular disease and diabetes. Therefore, it is important for patients with rheumatoid arthritis to consume high-quality dietary fiber. Selenium and vitamin E. Selenium levels are low in patients with rheumatoid arthritis. Selenium helps reduce levels of free radicals, oxidizing agents, prostaglandins, and leukotrienes. The substances mentioned above are found in high levels in patients with rheumatoid arthritis. Lastly, probiotics. According to a study published in American Journal of Nutrition, 46 rheumatoid arthritis patients divided into 2 groups. One group given lactobacillus and the other group without lactobacillus. After 8 weeks, the study found that the various inflammation levels were significantly reduced in the group that continue to take lactobacillus. Therefore, it is strongly recommended that patients undergoing treatments for rheumatoid arthritis take probiotics. So if you're tired all the time or burn out because of stress or suffer from rheumatoid arthritis, then your body needs a detox. To help you start detox quickly and easily, I prepared a checklist so you can check whether your body needs a detox. Also, I have included a detox juice recipe below, which you can download for free. So if you like this video, please subscribe to my channel in my YouTube. Also share it to others. Thank you.